Let's talk about strategies that we as physical therapists and a lot of personal trainers, strength coaches use. We're gonna give you two strategies. You see which one would make more sense. Okay, so we've got a patient that I'm going to teach a new exercise to. So we're gonna teach him how to do a chop. He hasn't done this before. Here's strategy number one. So you're gonna split your stance, reach over that back foot with the weight. And when you come up, you're gonna reach back over your left shoulder when you get to the top. So all the way up, perfect. Okay, now, what I want you to do, really concentrate on is when you're coming down, keep this muscle engaged, feel like this is lengthening, and then when you come back up, you're gonna really feel like you're engaging this, but your arms are gonna be relaxed, but your trunk is gonna stay engaged, okay? So try that. I think you can tell which one of these is not gonna be the right one, okay? Now, do you feel like you're engaging all that stuff?
I can't remember what you said in the first place.
Bingo. Okay. Now let's try option number two. So what I want you to do is put the weight over that foot, and you're going to reach up like you're putting it on a shelf over this shoulder. So come on up. Yep. And you're just going to keep on doing that. Okay. Now as you're doing that, what does that feel like when you're going down? What does it feel like you're using?
It feels like glutes, quads, hamstrings,
okay,
all that stuff.
And then when you come up, what does it feel like you're using?
Same things, and then also my back, really elongating my back.
Okay, perfect. Okay, so first strategy, I tell him what he's supposed to do. Now keep in mind, if I've got somebody that I'm teaching this to and I haven't examined them, I haven't given them an exam for neuromuscular function, he could have inhibition, which means I just gave him a bunch of verbal cues, which sounded like verbal diarrhea to him, and his body has absolutely no clue how to do that if he has inhibition. So I just screwed him both mind-wise and both physically. I've told him to do something he can't do. Okay? The second time, I had him do something and let him do it the way he can do it. So if he had inhibition and he said, well, I don't really feel like I'm using anything, or I have pain, or I have tightness, then I could say, okay, there's probably inhibition of those muscles that should be firing in those positions. I could put him on the table, assess, reestablish normal facilitation, get him back up, redo the exercise, and then say, what does that feel like? And he would say something like he did the second time, because I already worked with him today. Okay, so everything's already on. So option number one is what most PTs, personal trainers, strength coaches do. I tell you what you should be doing, even though you can't do that and you don't understand a word I just said. Then we spend a half an hour with me trying to break down the movement pattern and screw you even more. Or number two, you can let them do